Okay, the third question is that my 6-month-old son suffered a seizure on January 17, 2012 after receiving his 6-month vaccines, one of them being the influenza. He got a fever of 102 Fahrenheit and had a seizure lasting 20 minutes by the time paramedics arrived. They had to give him Valium to stop it. Is it normal for 6 months old to have seizures? And what can I expect now? And I can't keep my eyes off of my son, and I live in fear and panic every day. Again, I'm very sorry that your child suffered from very prolonged seizure. The description of seizure and the situation where his seizure developed sounds like he had one of the prolonged febrile seizure. Now, if you look at the literature, and in my own experience, febrile seizure is not the same as having epileptic seizures. Unlike adult's brain or mature brain, developing brain or younger children's brain is very, very susceptible to fever. So no matter what the cause is, when a child develops high temperature very rapidly, they could go into febrile seizure. Now, most of seizures are typically less than 5 minutes, just simple grand mal seizure, and they don't have any complication. However, occasionally the seizure could be prolonged and long-lasting and needing some emergency treatment. Our data suggests that whether you had 4-minute seizure, 5-minute seizure versus 20-minute seizure, the long-term outcome may not be very different unless there is a certain factors. For example, if there is a abnormal MRI lesion or MRI findings, or EEG data, EEG shows some abnormal findings. In that case, you have to be suspicious that actually the febrile seizure may have been the initial process of developing epilepsy, meaning that potentially there was a dormant pathology and unmasked by fever. So at this point, rather than being worried about your son's future and the long-term the seizure recurrence, I would probably get a consultation with neurologist. Probably run a EEG and good quality MRI just to rule out any kind of hidden brain pathology. As long as these two tests are negative, I don't think there's any significant chance that your child will develop epilepsy. And I do not believe that your child needs medication at this point either.